Welcome back to Strictly Sex. I'm Dr. Drew. Since the birth control pill made its appearance in the 1960s, women have discovered a whole new level of sexual freedom. These pills are synthetic hormones that mimic a woman's natural hormones. They're estrogen and progesterone, and the pill prevents ovulation by tricking a woman's body into thinking that she's already pregnant. On the plus side, there are far fewer unwanted pregnancies. But for some, the wonder drug has also wreaked havoc on their sex drives. So how common is this problem? Here to answer that question and more is our next guest. She graduated from USC School of Medicine, did her residency at Cedars-Sinai Medical Center. Here in Los Angeles, please welcome OBGYN Dr. Taz Varkey. Thank you. Thank you, guys. I really appreciate it, Dr. Varkey. So, your task is to explain how the birth control pill works and why it has such a profound effect on women's sex drive.
The birth control pill basically, as you said, tricks your body into thinking that it doesn't need to ovulate. It suppresses ovulation.
So the egg never gets released from the ovary.
The egg never gets released, and that's the primary function of it. To do that, most birth control pills have estrogen and progesterone in them. And it's the function of the estrogen and progesterone that may cause problems with women's sex lives.
Okay, so how does the estrogen cause a problem?
The estrogen causes an increase in a protein called sex hormone binding globulin. When we have increased concentrations of this protein, it actually also absorbs testosterone from the bloodstream.
And testosterone is what causes our brain to drive.
Is what we believe to be a major player in sex drive, sexual function, arousal, orgasm.
And how about progesterone?
Progesterone actually downregulates estrogen receptors, meaning it turns them off.
So what makes this even more confusing is that not all women respond the same.
That's right.
So what you're describing even may be one way in one woman, different in another.
Exactly.
Interesting. Well, we're going to look at a woman right now who believes that the pill affected her sex drive. Her name is Marilyn Burkholder.
I decided to start taking the pill because I just wanted an easy way to make sure that keep myself from getting pregnant, and it seemed like the best thing to do.
For 5 months, Marilyn was pleased with the results, but then she began experiencing a surprising side effect.
Before I started the birth control pill, I thought about sex very often. In fact, I did have sex more often than I do now. After I went on the pill, I was not as interested in sex.
None of the information she had been given mentioned decreased sex drive as a potential side effect for the pill. So Marilyn felt certain the change was emotional, not physical.
I thought maybe it was because of my boyfriend that I was losing interest. We were having a hard relationship. It wasn't really working out. We were fighting a lot more, so I thought it had to do with him more than the birth control pill.
But when that relationship ended and Marilyn went off the pill, something suspicious occurred. Her sex drive returned. When she began a new relationship, she faced a dilemma.
After I got involved in the serious relationship, I approached my gynecologist because I was concerned about taking the birth control pill again, and I told her about my problems with my previous birth control pill.
Her doctor prescribed a different type of pill. But just like clockwork, 5 months down the line, Marilyn noticed the same decrease in her sex drive. In the end, Marilyn tried 3 different formulations, but with each one, she suffered low sexual desire.
The lack of sex drive with my boyfriend is difficult. It's something that we end up talking about a lot. I miss wanting to have sex. I miss having sex. And if I can't get excited enough to have sex, it feels like something's missing.
Now Marilyn worries that she may never find a birth control pill that will work for her.
If I could ask Dr. Drew about this problem, I would ask him, why does my body react this way to the birth control pill? Why does this continue to happen?
Well, Dr. Varkey, do you think that's a typical story that Marilyn's got?
Yes, it is a typical story.
How would you approach her? If you were trying to treat her, how would you approach the problem?
You know, I think it would be important for me to know exactly which formulations of pills she's tried. And the reason that's important is because for somebody like her, you want to bring down the estrogen levels in her pill and find a progesterone that has some testosterone-like activity. Some progesterones have more testosterone-like activity than others.
Now, the one I keep getting complaints about when I'm talking to young people is about the progesterone shot, the depot shot.
Right.
Does that have no testosterone?
No, that actually really has very little testosterone activity, and it's also a very large dose
Well,
of progesterone.
let's specify for people what that is. It's a shot that young women can take once every 3 months. It's a very important way of achieving contraception.
Absolutely.
It causes problems with bleeding and then no bleeding subsequently.
Right.
And sometimes depression, and in my experience, a lot of shutdown in libido.
Right.
You know, I found women aren't discussing those things with their doctors very much.
Yes, I think they're a little bit embarrassed. They talk about it more with their girlfriends. So when you try and determine what the percentage is of women that have these complaints or problems on contraceptives, it's very difficult to do so because they don't always bring it up.
And any other medication women should be aware of? Do you educate your patients? That may give you a problem with libido? Any things that you sort of alert women about?
Antidepressants, antihistamines, because they can cause vaginal dryness, just like lack of estrogen can. Antihypertensives, they can cause decrease in blood flow to the genitals, just like it's causing decreased blood flow everywhere else. You're bringing down someone's blood pressure.
Those are the most three common that I hear.
Absolutely.
And with SSRIs, the so-called serotonin reuptake medication being perhaps number one.
Right.
And serotonin reuptake inhibitors include like the Prozacs, the Zoloft, the Solexas, Lexapros, things like that. The ones that do not cause typically libido changes are Remeron, Wellbutrin, and Cerazone. Those are things that you can talk to your doctor about. Whatever you do, do not change any of your medication without talking. We are not advocating that. Do not change your medications without talking to your doctor. And in most cases, the good news is there's something that can be done to get sex drive back on track. Thank you very much, Dr. Varkey. We really appreciate you coming.